Good afternoon, everyone. This is Alan Cooper. Also helping me today during this basic training will also be Lisa Locken. The topic of today is basically data integrity related to summary reports and the new function called Excel templates. And we're hoping to get everyone a little more familiar with this. Again, this is the basic training, so we're hoping that this gets a starting point for people, and then as we create additional training, we'll have some advanced ones as well as offering one-on-one to those who are more interested for learning more. So the objectives of today are how to ensure that integrity of the data is improved by leveraging some of the quality of the reports. The next three are related to the new concept called Excel Templates Toolkit. And this is kind of giving the ability to leveraging your detail extract a little bit better by kind of having these tools available to that are common across the hospital in terms of understanding your data better to help you improve your quality. So the first thing is the data integrity and usage of reports. So one of the things that we've been kind of either hearing throughout across the hospitals or just in general, whether it's feeding information to other entities such as WHA through Checkpoint, is ensuring that the data that is being entered into PERI data is being complete enough to actually present the data back to, whether it's internal reports or, again, out to external entities such as Checkpoint. So we just want to take a few moments to kind of highlight what we're speaking about when we talked about completing your data. The first topic or completion is typically related to the state required. And inside of PERI data itself, and this is more for those that are actually entering in the data, is to kind of be aware of some of the notification or icons, if you will, as you enter the data. So when you look at state required, you'll notice that any state required field when you're inside of PERI data will be noted with a little symbol box next to the actual field name. And that will indicate that the state for servers for vital records requires that these particular fields be filled in. Now, very similar is what we're calling hospital required fields. And these have a little bit different symbol called with a triangle. And you may notice that in some of these fields that you might see both symbols, which means that the field is required for both of the areas. Now, talking a little bit about hospital required in general, this one is initially was meant for Checkpoint in terms of the necessary fields that need to be populated to ensure that your Checkpoint reports or your measures that are submitted to WHA are complete. This is expanding a little bit to other programs that we're offering, such as the hypertension one or the HIV. So just be aware that just because it's flagged as a hospital required, it's not exclusive to just WHA anymore with the Checkpoint. Other things to make note is that even if you're not within the record itself of creating the birth event or editing one, you'll notice you'll have some tips on the navigation bar indicating that if you go into the hospital incomplete or the state incomplete, these are the births that still need some fields to be completed to ensure that, again, the birth of itself can be incorporated into whatever report that is required, requiring it to be complete. And obviously everyone probably sees this when they're in the PERI data. It's kind of just indicating the status of how many complete records and how many are left incomplete, and etc. And then if anyone has any questions, in terms of what is complete, there are these worksheets that a lot of you is probably leveraging in terms of actually capturing your birth data. And these have been updated most recently in the last probably month and a half, again, to indicate, what is considered complete and not.
Okay, and Alan, at this point I would pipe in that if you are using these worksheets in one form or another, as to your point, please make sure that your staff has the most current sheet.
Very good point, Lisa. Thank you. Now on the side of it, now if you're a person that is not entering the data when you get the birth information, but you're more of a person that's going to review the actual results of the data through the reports, there are mechanisms to leverage on the report side to verify that there are some births that are incomplete that will ultimately prevent some of those birth records to be inserted or a part of the population of some of these reports. So, just some key things is, to ensure that the data is possible to ensure that good data comes out for one of the main purposes of this program is to be able to measure yourself and to see the quality of the information as a whole.
Okay, yeah, this is Lisa. I'll pipe in a little bit there too. Obviously, the people who are entering the data, to Alan's point, may not be the people going to use the data. And it's incumbent upon each organization to assure that what they have is in fact true and correct. And again, PERI-data is one piece of many pieces where you get your checks and balances to assure that things are correct for your organization. So just because something automatically goes somewhere else, it'll go however it was put in. So again, it's priceless to have good, solid data in there. And so on the next slide, we are going to see some of the ways in which those of you who use those reports or are accountable for those reports can go see, as a friend of ours would say, do a sort of sanity check on, could this possibly even be correct? So here's a couple of examples for that. We're using, in this example, the checkpoint summary and review. So on the summary, at least what I often do is that we're at the end of a month and we're going to go sort of true up things, print off a first pass or look at this first pass and how does it look? What percentages do I have? And then you can also see that it'll show the percent of records completed. And in our Ancilla Test Hospital here, unfortunately, only 9.4% are completed for the PCO2 measure, and it's coming up in my phraseology as goose eggs, 0%. Now I'm betting that the organization probably has better results than that, so you need to go figure out what's going on, where do I have records, and so on. Hopefully you're not at 9.4, but maybe 95%, and now, okay, what's wrong with the records and where do I go fix it? So if you go into that checkpoint review at the patient level, this gives the actual records themselves and shows perhaps where you have something not filled in. So you'd look for either some of the NAs where there shouldn't be one, or other types of information that would lead you to why is that record incomplete and so on. And then one can go back in and do edits on those, and then when you rerun it, you'll probably have a much more accurate report. Very, very important for checkpoints, certainly, since that goes directly into WHA, but it is also important for other things as well. So if something doesn't seem right, you want to go verify that prior to reporting that out to the people that will be using this information for decision making. Thanks, Alan. I think that's what I had to say on this.
Thank you. And again, one last point related to like a checkpoint review as an example, it's a detailed report. It doesn't get displayed on this particular screen, but as you go into this Excel document, you'll notice that we do highlight areas of green or red to indicate whether, you are in compliance or not for that, that particular record, to help you evaluate basically. The other thing to make note is we also indicate whether this particular birth record is complete or not, and you'll notice that one of the fields will indicate. And that's where you should focus on typically first. Is, those are the kind of low-hanging fruits of, you have full control of trying to make that complete, where in some cases the record may be complete, but you don't have necessarily control whether things were done right or not for that particular birth.
Right. So in those cases, if, like, for example, early elective delivery, all the fields may have been complete, but you've got one hanging out there that looks like it's falling out, then you would go in and look at that differently, like how come is it falling out? Is it truly a fallout, or did we forget to mark a particular field in the way it needed to be marked in order for it to pass?
Correct. So one final point on this area in general is if anyone ever has any questions, whether it's on the front end of actually entering the data and truly understanding, how to make something complete as it relates to a record for the hospital side or even from the state side, don't hesitate to contact our support desk, as well as if you're just struggling to find the reports to use to help you identify where there's opportunities, then again, definitely contact us. We want to try to remove any barriers that may be causing you from actually doing that. So with that, we're going to jump into kind of a new area that what we're trying to do this year and moving forward in general is to promote each hospital or health system to actually use their data. And for those that may don't have a lot of resources internally at their hospital to really take advantage of this rich data set, we're trying to pull together toolkits, if you will, to get each hospital a kind of a jump start in actually what are some of the common ways to use the information that's being done on maybe some advanced hospitals that maybe have resources to help them out. So the goal here is for those that are not leveraging the data as much as they can from a reporting aspect is to get you kind of started doing that and then give you examples of what's being done, and then hopefully this gives people enough experience with a starting point that they can start to expand beyond that and really focus on possible internal hospital programs to help obviously improve the quality of care. As I stated before, it's the Excel template toolkit, has probably 10 to 12 tabs, if you will, in an Excel document. And there is a range of either just pre-defined columns, and just to step back, everything is kind of driven based on the data extract from Pentaho. So you go to the Pentaho, you download the actual CSV file, the detailed data extract, and this one should probably use not condensed but the comprehensive version. And with that, you kind of, I'll show you how to do this. So you basically place the data inside this template, and then you have, like I said, 10 to 12 versions or different reports, if you will, that'll populate, and it kind of gives you the ability to see, sometimes you'll see more condensed columns that you care about based on the area. In some cases, we put together pivot tables that kind of provide you summary information or counts. And again, these are always starting points for you to take this and kind of go even deeper with it if you want. So I'll get into that later. Kind of going into how to use it, kind of alluded to this, is you download the detailed extract from Pentaho. You copy and paste, and I'll show you this, the CSV data, and you put this into the template toolkit, and then you complete a few refreshes at the pivot table level, and then you can start going with it. And it's really as simple as that. It's a process that should not take more than 3 to 5 minutes to do, and that includes probably the download time of the actual detail extract. So these are the list of available templates that are in the initial round, and our goal is to have this as a starting point, and then hopefully this kind of triggers a lot of hospitals to kind of expand beyond this, create their own templates, and then send some examples back to us so we can review with the data committee to determine should we enhance this template to add on additional reports that are useful throughout the hospital. What I'll do is pass it on to Lisa to talk a little bit about some of these templates.
Okay, thanks, Alan. The data committee started out by taking a look at either things that people had created on their own that the group felt others might like to see, or something that was either a little more complicated or whatever that they thought, hey, if we could share this, people would like it. So it's our first pass at taking a look at doing this and pulling certain things together without, 50, 75, however many hospitals trying to do it on their own. So we came up with these initial ones to try to develop at first. And so again, this is the first pass at them. So we would certainly welcome input as to, hey, I really like this, but I wish it had these 2 extra fields or what have you. So again, first pass, I did take a little test drive on it myself yesterday, and it was pretty sweet, if I do say so myself, Alan. So if we go to the next, I'll tell you a little bit about what each of these is supposed to have in it. The first one is birth by delivery type and by both OB, primary care provider, and attendant. I think a lot of people probably use something like this, perhaps in monthly reports. So it's a count of births by, as it says, by type of delivery or by attendant. And then you can be able to see whether you want to sort that by who the OB provider was and or who the attendant was. Similar to it is more of a pivot table, the number of deliveries by type and by the type of provider there. So this was a straight up count. So a lot of times clinics and so forth will want to know, hey, how many deliveries did our various people attend and that type of thing. So that gets at that. Residency programs often want to have reporting in by the residents of what types of procedures they have done. So we've pulled together something like this, and if nothing else, it's a check and balance against what the resident is putting in if they have to report that themselves. We've got a couple of breastfeeding things, patient level data on breastfeeding, such as gestational age, what nursery they went into, and exclusivity. And then also comparing how many people were breastfeeding based on delivery type. That's kind of getting at if you had a C-section, is that in any way influencing amount of feeding and so forth. Another one we have is some late preterm information. So again, this is sorting out all your 34 to 36 weekers and taking a look at a couple of birth outcomes, what nursery they went to, and that type of thing. And if we could have the next page. Couple of NICU things too that we started trying to work on was a census. This gets data on all the NICU babies along with the route of delivery and the gestational age at delivery. And that's, again, patient level. Rate of admissions by gestational age, that, if I recall, I think that's a pivot table, and that's got some information on route and birth weight. We've got 2 things on HIV quality reporting. I know in some facilities, or at least over the course of time, some providers perhaps were not as compliant as others with the recommendation to test HIV each pregnancy and so on. So we can get things by the count, how many yeses and nos they had by testing. And then there's also a patient level thing that lets you know if you had any no's or unknowns on the testing, so you can go back and check if that really is in fact correct or which cases those were. And then finally, there's a few facilities that want data on water births. And so we've got a little bit of information on moms and babies, and you can see there what some of the things are. That one, I'm sure the folks who need that one may desire some other perhaps comorbid conditions or things or that they'd like to have on there, but this was, again, a first pass at it. So those are the things that we started out with on our first set of templates. And so now Alan's going to show you, regardless of what you want, when you go and do this, it fills in all the templates at once by what he's going to show you. So I'll give it back to Alan.
Thank you. Okay, so we come kind of 4 steps. They're really not steps per se. It's just help kind of organize yourself a little bit. But you know, basically you kind of pull down the template and then you kind of want to refresh your data, and that's kind of the process. So the first thing to do is, if you don't have the toolkit yet, which will be hopefully available either today, we're hoping to push that out, or later this week. But as you can see, we're going to have it placed underneath the report server, underneath the reports section of the navigation, as you can see. And then if you click on that, you'll have a landing page. Again, it briefly describes what it's about. And then you'll be able to just click on that and you'll be able to download it. It's an Excel document. We also are going to place out version dates. So keep tabs on this date, and every time we update this toolkit, whether it's possibly fixing something that may have errors or adding additional counts to existing templates, or just creating new tabs for new templates. In either case, we will have a different version date out there so people are aware that they can compare what they have with what's already out there. So you just download and click that, and then the next step is you open up the template, and then you have to go and get your detailed data extract. And that, again, is in the reports area. So you click on the reports server, you go into Pentile, log in, go into the reports area, and download the detailed extract, the comprehensive version. And then once you do that and you download the actual TXT file, you actually go into the template that you downloaded initially. There's a tab underneath there called Detailed Data Extract. You click on the right-hand corner of the actual spreadsheet itself, and that basically, when you do that, it highlights basically every record, so every column and every row, and then you go into your actual detail extract CSV download. You do the same thing. You copy it, so Control-C, and then you go back to the detail extract, and then you paste it. And then now the data is inside of your template. Now, depending on how big the data you bring down is, what we did is we have a preset formulas for each of the tabs that basically kind of are populated based on how many rows you have, and we have it up to 500. And so if you bring down a data load that I guess above 500, you will need to follow the step of basically copying the rows down to as many, I guess, rows you have in your detail extract. If you are a hospital that you routinely have more than 500 in terms of what you want to evaluate, we could help you out by doing this for you and send you an updated version. And I guess what we'll probably end up also doing is if we do get this on a routinely basis, we may have a few different versions out there where we might have up to 1 to 500 row 1, we might have 1,000 row 1, and 2,000 row 1, etc. available to you for you to download. For step 4, once you have, again, brought in the actual detail extract into your to your toolkit, you need to go and actually update your pivot tables by right-clicking or clicking on the actual pivot table itself and right-clicking and hitting refresh. And that makes sure that your pivot tables actually recalculate themselves to make sure that it's actually taking the most current data. But once you do that once with that data set, you don't need to do it every time you open up your template in the future. It's just really anytime you just update your main data, in this case it's a detail extract, you need to do this. And it's only for the pivot table templates. You don't need to do this for the other ones. Those inherently just will be up to date. Some other tips. We do have one report called the late preterm info, and this is basically the range of 34 to 36.9 weeks. And basically, there's a filter on that particular one that we recommend you don't touch that, because otherwise it doesn't become a 34 to 36.9 anymore. Obviously, if you're advanced using Excel, you'll know how to recreate it again. But the goal here is that you need to reapply the filter for this particular report to ensure that it's actually pulling in the correct record. Again, there's only one report at this point that is actually doing this. We just wanted to highlight that and show you how to actually reapply it to ensure that you get the range, basically the births that are within this range of the week. And then this is just another Excel tips of when you're actually using the pivot tables, you know, how you can actually filter on certain things, whether it's the columns or you can actually filter on at the report level by clicking on the arrows there. But basically it will highlight what values you can filter on, and you can actually condense your view. So as an example, if NA for the delivery method makes no sense to you, because you want to have a more cleaner report, you can actually just filter them out by disabling them from showing up. Same with the rows side of it. If you only want to look at one particular row, or if you had a few that were at 35.6 in terms in this case, and for the age, you can filter the rows as well. And then finally, if you do have a detail extract that has multiple facilities, you can also filter on one or many facilities. And this becomes a little bit more advanced, but if you, as you feel more comfortable with the pivot tables and the template itself, you do have the ability to actually customize some of these by adding additional either rows of information. So if you wanted to know something about the date of birth, as an example in this case, or something about a different field that is available to you in the pivot table, you can definitely drag and drop these into either columns or rows, and then basically your pivot table expands or contracts depending on what you are doing with those additional fields that you add to your pivot table. So since we have some extra time, I wanted to make sure I covered this. We can either jump into any questions that might be out there, or I was just going to quickly just kind of show everyone how to actually do some of the things that we actually talked about. Is there any questions out there?
We're not seeing any right at this moment, so perhaps if you want to get into a brief demo, and then as any questions come up, we can feed them to you.
That sounds great. All right, so what I will do is I will make the assumption that I have pulled down the template. So the action of going into Perry data and pulling down the template has already been done. I will briefly just show for those that are unfamiliar with where the detail extract is. I will I'm still logged in, show you where that's at. So if you log into Pentaho and you get this screen, you click on Browse Files. And then if you look in the folders, you have your public, and then you have your reports. And then if sometimes if it comes across like this, where things are collapsed, you just hit on the arrow to expand, and then hit an arrow again for reports. And in this case, it's underneath the detail extract folder. You click on that detail extract folder, and you'll see the files here available. And the one that you will want to take is the comprehensive detail extract. So if you just click on that, click open, and then if you have more than one facility, you can select more one to many, and then you just select the date range you want to actually download. And then you just click on View Report, and it's processing, and you'll notice on the bottom if you're using Chrome, the report will be down there for you to take, so you can just either just open it directly, which I'd recommend. If you are in Internet Explorer or even Firefox, there's a little bit different way of how I think Internet Explorer has a pop-up box that says you want to save or save as. I would recommend you do a save as and then go save it at a directory that you can find it. I think you do also have the ability to open it. You can also just open it just as well. So after you do the download, and then you have your template, you basically open up both. And then before I do anything, I'll just show you like how things change. So you'll notice in this particular one, there's 8 records or 8 births, right, for this particular template. And then you'll notice the aggregations here of the total age for this particular template, and so forth and so on. And you just kind of notice the volume here. And then once you want to do an update, you just click on this right-hand corner here, and then you do a right-click and you do a copy. If you don't want to do a right-click, you can just do this, and then Control-C does also a copy. You go into your Detail Extract tab. You want to make sure you highlight all the rows, and then you just do a paste, either by doing a right-click and a paste, or you can also do a Control-P, and you'll notice that now I have more. I used to have 8, now I have 12. And it just happens. Everything is just already there. And then these are the pivot tables, which I'll get to, that you'll notice that it still says 8. But actually do a refresh, make sure you click on the actual pivot table. So basically put the cursor inside the pivot table itself. And then you can either do a right click and hit refresh, or you can actually go into, you'll notice once I'm here, there's this Analyze and Design. If you click on Analyze, you can actually click on and hit refresh up here as well. For me, it's just simpler just do a right click here and just hit refresh. You'll notice added on one more, looks like another attendant possibly, or a PCP actually. And you'll notice my count went from 8 to 12. And if I had more than one per facility, you can, right now it's showing all, but if I just want to look at just my sample medical center, you just highlight the one you want. If you want to select multiple, you can do that. If you have more than one, you just want to isolate it. These are the column filters. So if I didn't want to see the NAs, you'll notice I just clicked on the little arrow thing, and then just disable by unchecking the NA, and now you'll see that I just see the NAs, or no NAs, or if I want to add it back, you just click on the same thing, click on the NA, and it'll come back. And this applies to all the pivot tables here. And to kind of navigate through, you'll notice that you got to keep on clicking. You can also click on the arrow here to kind of scroll through all of the templates here. And this one I'll do a refresh. Now here's the late preterm info list that I mentioned before. You'll notice this one's already pre-filtered. What you want to do here is right-click on the actual column, and then go to filter, and then just say click on reapply. You'll notice that kind of updated the filter for this particular report. And then everything else should be updated that is not a pivot table. Here's one more pivot table here. And click on refresh, and then you should be all set. The other thing I'll highlight here is we also have an area called detail extract columns. So these are all the columns throughout the reports that are being used. And if you want to actually go to one of these columns in your detail extract, what we put here is links to the actual column where it's at. If you want to find where the attendant was, you can just click on this link, and it'll actually take you to that column inside of your detail extract, just to make it easier, since there is, I think, almost 800 or so fields. And as we expand the templates or add more columns to the template that will be leveraged inside these templates, this list will grow. And again, to try to make it easier on everyone, we try to create these links to actually get you to the right column. You also notice that we also have, as you actually download it the first time, you can actually start here to actually go to the right template you're looking for. So if you wanted to go to the water burst one, you want to go scroll to it, you can actually start here and actually get to it right away. And I'll take you right to the actual template. And this also, again, gives you the same description that we had Lisa kind of review with you as well. And then there's also how to use the template. Some of these instructions you'll see that we have already kind of highlighted today in this presentation. And I think that covers it. Lisa, do I have anything else, or do you have any questions that I should, or any areas I should highlight more?
Well, the one question was, will these instructions be available on the Peridata website after today's webinar? And then hopefully, as you can see how to use templates, there are some instructions there. I guess if we determine that that's in need of further expansion, we can do that too. Also, this webinar is being recorded, so it will be able to go on the WAPC website after they load this up in order to kind of listen to this at your leisure, as it were. Again, I think once this pushes out, I think I would advise everyone to go ahead and give it a try, see how it's working for you. Give us recommendations for other things to add, change, etc. Okay, I'm getting a question. When do you think it would be possible to expand the rows from 500 to at least 1,000 or more? Because I think there are people who are doing, like, even if you did like a year's worth of something or so on, that are going to have probably several thousand.
Yeah, that is something that, it's something that we actually started thinking about in the last few days. So, I think what we'll probably do is have maybe 3 or 4 different versions, and then people can just pick their version based on their size. So the smaller hospitals, the 500 might be appropriate. Some of the larger ones with multiple facilities, maybe we'll have like a 5,000 row one, if that makes sense. I mean, the one thing to keep in mind is, some of these are intended to hopefully, isolate your information. But in some cases, like the birth by PCP list, well, there's no filters, right? But, so if you do want to see more than just that, part of this goal is to really just get you the information of the key information you're looking for, not necessarily limiting information. So, you know, maybe we'll make a 500, 1,000, a 5,000 version, and maybe even a 10,000 version if that's something that makes sense for the groups.
Mm-hmm.
And we'll get that out this week.
Yeah. Okay, so again, this is a way for, what we're trying to do is share so that number one, it's consistent, and probably number two, even more importantly, that we don't have to have each facility spend a lot of manpower making up some of these that would be fairly common for you to go looking at. And then again, that detailed data extract can do a lot, but it's also kind of daunting when you have all those columns and you're trying to filter through them. So this is the effort to help make that easier for you. As I always say, you know, how can we hit the easy button? So this is a priority here in 2016 to help you with that. Are there, I do not see any further questions. If people have any more, please type them in. And I don't know, Alan, did you have any, was that the end of the slides that you had?
Yes.
Okay. So we'll give you just another moment here for questions. Otherwise, I'm sure all of us would appreciate the gift of time. If there are no further questions, there's nothing that says we have to hang out for a full hour, right?
Correct. Yeah, and then, I mean, I guess, as Lisa stated, you know, familiarize yourself a little bit, but don't hesitate to ask for help. Contact our support desk, and we're gladly to do one-on-one support on this to help navigate through some of these things, especially for those that are not really familiar with pivot tables, or there's some that are just maybe not Excel savvy, and that's fine. We want to try to get you there so you can actually, you know, use your data in a manner that's useful.
Okay. And I'll put in one last plug again about how important it is for someone in your organization to be reviewing, looking through this stuff, and making sure, does this even make sense for what we know our practice to be, so that you can ensure that you've got high quality, high level data that you can trust when you're going ahead and making decisions and using this for whatever purposes that your organization has.
All right.
I think with that, thank you so much for your time today. And again, our contact information is available. Don't hesitate to give us some feedback. Thanks very much.
Thank you, everyone.